Let's see an NCLEX RN video based on care of patients with hearing disorders. A nurse working in an ENT clinic has been received 4 messages from patients. Which patient should be called first? The mother of a 9-month-old baby post-laryngotomy who needs clarification of discharge instructions. A patient with external otitis seen yesterday in the clinic. A 62-year-old patient well known to the ENT clinic with sudden unilateral hearing loss and disorientation. A parent of a 4-year-old with repeated otitis media. A 62-year-old patient is presenting most probably with Meniere's disease and is at a risk. So this is the patient who needs to be called first. The registered nurse has a licensed practice nurse working on a team on the ENT floor today. Which task is suitable to delegate to the LPN? Discharge instructions to a patient who is waiting for his ride home, admission assessment for a new patient, a dressing change, assessment of a post-operative laryngotomy with a fever of 102 degrees Fahrenheit. A dressing change is a suitable task to assign to an LPN since it does not require teaching or assessment, which are RN's responsibility. Which statement indicates that the patient with Meniere's disease understands the disease process? Often a fever is present. Symptoms occur usually once or twice a year. Symptoms usually occur in a group of 3. Surgical interventions will provide a cure. Commonly, symptoms of Meniere's disease occur in a triad of 3, that is one-sided sensorineural hearing loss, tinnitus, and vertigo. Which information does the nurse include in the discharge instructions for a patient with otitis media? New bloody drainage from the ear canal is suspected. Take all prescribed antibiotics until they are gone. Do not use acetaminophen or products containing it. Use of antihistamines will increase recovery time. So, it is essential to have patients take all the medications until gone to ensure proper healing. Many people stop taking the medications once they start feeling better. So this is an important discharge instruction for a patient with otitis media. Which of the following is a disease process and not just a symptom? Vertigo, tinnitus, presbycusis, Meniere's disease. So Meniere's disease is a disease that commonly has 3 symptoms, which are one-sided sensorineural hearing loss, tinnitus, and vertigo. The nurse correlates which complication to a diagnosis of otitis media? Labyrinthitis, mastoiditis, tinnitus, bilateral hearing loss with inability to hear high-pitched tones. So here labyrinthitis is an inflammatory disorder of the inner ear labyrinth that occurs as a complication of otitis media, which result in a disturbance in balance and hearing. The complication may be unilateral or bilateral. Nurse recognizes which diagnostic test as the best method to confirm the presence of fluid in the ear that increases the patient's risk for developing otitis media. Pure tone audiometry, speech audiometry, tympanometry, acoustic reflex. Tympanometry is the test that measures the impedance of the middle ear to the acoustic energy and is commonly used to screen for fluid in the middle ear. Pure tone audiometry is a test conducted with air and bone conduction initiated to quantify hearing loss. Acoustic reflex is a test that notes a response of the stapedius muscle to the presence of loud sounds. The medical management of the patient with otitis media includes which priority interventions? Administration of oral antibiotics, administration of steroids, use of anesthetizing ear drops such as tetracaine, administration of decongestants to prevent eardrum rupture. Antibiotics and comfort measures are the highest priority for otitis media. Steroids are not indicated in the treatment of otitis media. Tetracaine is not the priority as it addresses only the pain, and the antibiotics are the definitive treatment. Decongestant may be indicated with associated sinusitis, but again the antibiotics are the priority. The nurse recognizes that which priority assessment are included in the evaluation of a patient with hearing disorders. Cranial nerve 3 assessment, cranial nerve 7 assessment, complete and comprehensive history, otoscopic examination, diagnostic audiogram. A complete and comprehensive history with otoscopic examination is important for the assessment of patients with hearing disorders. Only cranial nerve 8 is directly related to hearing, so complete cranial nerve assessment is not indicated. While baseline data like height, weight and vital signs are important, they are not specific to hearing disorders. The audiogram may be ordered, but it is not indicated in disorders like otitis media. The nurse recognizes which risk factors for the development of tinnitus. Overuse of medications containing salicylate, family history of chronic respiratory infections, involvement in water sports activities, history of migraine headaches. Salicylates, then quinine, diuretics, selected chemotherapeutic agents and certain antibiotics are associated with the development of tinnitus. There is no relationship with Parkinson's disease, respiratory disease and others with this development of tinnitus. Involvement in water sports is more often associated with external otitis media. Migraine headaches are not associated with tinnitus. The nurse correlates the pathology of hearing disorders to which change in function? An abnormality in the auricle, disturbances in the semicircular canals, disturbance in cranial nerve 9, disturbance in cranial nerve 8. Hearing loss is often associated with cranial nerve 8 as its function is related to hearing and equilibrium. The choroid is in the eyes and the disturbance in the semicircular canals are more closely related to vertigo. Cranial nerve 9 has no role in hearing. And the abnormality in auricles also will not be a problem for hearing disorders. The nurse includes which information in the teaching plan for a patient suffering from vertigo? Addressing safety issues, administering antipyretics as ordered, taking a hot shower when clinical manifestations are severe, maintaining strict bed rest for 24 to 48 hours after clinical manifestations appear. For a patient with vertigo due to dizziness and possible issues with equilibrium, it is important to include safety issues in the teaching plan of patients with vertigo. Antipyretics are not indicated. Hot showers may exacerbate the clinical manifestations. While the patient should be taught to change position slowly, there is no rationale for bed rest, strict bed rest. The nurse correlates which clinical manifestation in the patient with Meniere's disease being received from the emergency department. Fever greater than 101 degree Fahrenheit, seizures with nystagmus, bloody drainage from the ear canal, vertigo and tinnitus. Clinical manifestations of Meniere's disease include tinnitus and vertigo, as well as other symptoms such as nausea and vomiting. Meniere's is not an inflammatory or infectious process, so there is not associated with any elevation in temperature. Seizures are not seen in patients with Meniere's, and bloody drainage from the ear canal may be observed with a ruptured eardrum. Maggie, 56-year-old, has been experiencing dizziness, nausea, and right-sided hearing loss intermittently for several hours every 2 to 3 days for the past month. Maggie takes no medication on a routine basis and has no significant past medical or surgical history. Though she does suffer from severe seasonal allergies in the spring, Maggie's mother had a past medical history of Meniere's disease. Maggie's provider performs comprehensive current and past medical histories as well as a complete physical examination. Nothing is apparent on physical examination. The provider refers Maggie to an otolaryngologist for further evaluation. On the basis of the clinical manifestations and physical examination, including the Romber's test, a tentative diagnosis is made of Meniere's disease, and Maggie is started on low sodium, caffeine restricted diet and antivert and Phenergan. An MRI of the head is also ordered to evaluate for a tumor on cranial nerve 8. The provider is most concerned with which clinical manifestation that could represent early presentation of Meniere's disease. Seasonal allergies and right-sided hearing loss, her age and episodic nausea, her dizziness and right-sided hearing loss, seasonal allergies and nausea. Dizziness and unilateral hearing loss are common symptoms with Meniere's disease. So here, dizziness and right-sided hearing loss for Maggie. The provider is concerned about what other aspects of Maggie's history? Her mother's past medical history of Meniere's disease, her severe seasonal allergies, her hearing loss on one side only, her age. Meniere's disease does tend to have a genetic tendency. So people with a family history of the disease may be at higher risk of developing the disease. What is the priority nursing consideration for Maggie? Making sure that her allergies does not progress to asthma, implementing safety measures, providing medication to help suppress nausea, reassuring her that symptoms will be relieved after allergy season. Safety is always a big concern with Meniere's disease, as the dizziness and hearing loss puts them at greater risk for accidents from falling or lack of awareness from inability to hear. So need to implement safety measures. Assuming that Maggie is diagnosed with Meniere's disease, what is the next step in her care? Referral to an ENT specialist, a STAT CT scan to definitively diagnose Maggie, administration of medications to stimulate the CNS, antibiotic therapy to determine if the symptoms are infection related. The patient should be referred to an ENT specialist for more comprehensive testing. What does the nurse teach Maggie about surgical intervention for patients with Meniere's disease? It's a well-known cure. It may be considered for those with severe unrelenting disease. There is no surgical intervention for this disease. It's only about 25% effective. Surgical intervention is only considered when Meniere's disease is debilitating for the patient. So here, it may be considered for those with severe unrelenting disease. Hope you understood this video. Thank you so much. Please do subscribe and keep watching for more videos.